following paid program does not necessarily reflect the views of this station, its staff, or Clear Channel Media and Entertainment.
Live from downtown Honolulu, it's The Moving Body with your host, Dr. Bernie Portner of Portner Orthopedic, recognized as Hawaii's leading sports medicine and orthopedic specialist. And now, here's your host, Dr. Bernie Portner.
Good morning, Hawaii, and welcome back to The Moving Body, this time live, December 27th, if my watch is right. And happy holidays, everybody. I hope you all had a very wonderful Christmas, and Hanukkah, and Kwanzaa, and Festivus for the rest of us, and Box Day, and all kinds of holidays. But Christmas is celebrated at my house recently. I grew up Jewish. We celebrate Hanukkah. We say Hanukkah like you're clearing your throat. But my daughter Talia has married a Christian man, Clay, a wonderful guy, and they have a daughter, my granddaughter Aviv, and Aviv has a dual heritage. So we have a Christmas tree and lights outside, and we light the Hanukkah candelabra, what we call the menorah, as well, and she gets tons of presents. I guess that's the upside of being in a dual religious home. But it's all a good cheer and goodwill towards man, so and women and girls and boys and people. So it's a wonderful time of the year. I'm enjoying it. I have a little vacation here, although the office is open Monday, Tuesday this coming week, and then we're closed for the New Year's break, and then back to work on Monday, a week from Monday. I think that might be the 5th. But that's a long ways from now. We have a family, as a lot of you might have, family from out of town. My son is here for the holidays from Northern California, where he goes to school. And the rest of my kids are here, although this little family I told you about with my granddaughter just left for New York to be with the father's side of the family in Long Island. So we're missing them. But nowadays with Skype and FaceTime and phone calls, we can stay in touch every day. Let's see, 521-8383. I almost forgot. This is a call in and ask me anything you want about arm, leg, neck, or back pain. I am an MD specializing in the diagnosis and non-surgical treatment of painful conditions affecting the limbs and spine. And here today and every Saturday at this time to take your calls and try to answer your questions. In years past, this has always been a slow weekend for calls. A lot of people usually listen to me on the way to work, for example, and a lot of people have off today because of prolonged Christmas holiday weekend. So, and sometimes I don't bother doing the show, but lately I'm enjoying doing this show more and more, and I'm realizing I have many loyal listeners, and it encourages me to be a loyal radio host. So here I am. I see there's a call coming in, although I don't have the name yet. But it's happening. And if you're listening from a neighbor island, you can call toll free 1-888-565-8383. That's 1-888-565-8383. That long-distance toll-free number also works from the mainland, I found out, because it turns out there are people who are listening to the show on iHeartRadio, a live streaming service, and they can hear me on the mainland, and sometimes they call, but they can call toll-free, just like the neighbor island callers. 888-565-8383. Let's take this first caller. Brian, go ahead. You're on the air, and thanks for calling.
Good morning. I thought I'd bail you out.
Man, you got no idea how much I appreciate it.
Anyways, the reason why I'm calling is because I am post shoulder surgery.
Yes.
I the doctor did a great job patching it up. Thing is, though, I'm having a problem with my supposedly good shoulder now. Because I had to sit around for so long, I got atrophy, and I've been given all kinds of exercises to do, which I'm doing, and if they're healthy. But I'm wondering if there's anything else I can do because the only problem I'm having is I'm a surfer, right? And my humerus bone is kind of flopping around in the joint there and all this.
On your unaffected, unoperated shoulder.
That's correct.
The operated shoulder is doing fine.
It's actually doing a little bit better.
Better than the good shoulder.
Yeah.
And the good shoulder was good until after the operation, or were you starting to have a hint of problems over there?
I was starting to have a little problems. And I have the feeling I was getting weak at the time.
Right.
All of the exercises I've been doing now seem to help the overall
The word weakness kind of sets off certain alarms. Some people use the word weakness when they actually mean discomfort, and therefore they can't use a full force because when they try to, it hurts. But true weakness is a problem unrelated to typical shoulder injuries, as if you had a nerve injury causing the muscles not to work. So when you say weakness, that's a word often used for discomfort and inability to use the arm with full force, rather than neurologic weakness. I know it's a tricky subject.
No, I think you nailed it, though.
Yeah.
You're on the right track, I think.
Right, because to imply you had weakness, I mean, yes, if you're resting your arm, it will slowly atrophy and get weak. That part is true. But I have a feeling that you just have a problem in the other side, perhaps completely unrelated to the surgical side. You say that it feels like the humerus is flopping around. It sounds like you're describing what we might call instability. Has the shoulder ever gone out of joint, dislocated, so it had to be put back in?
No, it has not, but it's certainly tried a few times.
I see. And have you spoken to your surgeon about this side?
Yes, he had, and he said that I need to do exercises because basically, if it ain't broke, you can't fix it.
Well, but it sounds broke if it's not broken, but I mean, it sounds like it's not normal. So I don't know over the phone. It's not a simple thing to say, oh, yeah, well, it's typical. You had surgery on one side, now your other side is weak. Just do some exercises. You should be all right. That sounds convincing, but it's not. You have a discomfort in your shoulder and a sensation that it's about to go out of place. And yes,
well, it's not really more like a sensation. It's more like you know when you do a push up, do you surf at all?
Yes, I surf quite a bit.
That's what I thought.
Yeah.
So when you stand up,
yeah,
and you're just about to the point where you're about ready to pop up and put your legs underneath you.
Right.
At that point, sometimes, let's say you're on a wave and you have to abruptly stop because some guy's in your way.
Yeah.
You know, you have to stick your legs in the water and you have to force yourself to stop, right?
Right.
And that particular move is the worst one of all, where I have my hands on the side of my board holding on to it, and when I have to slow down, it actually kind of levers my humerus bones forward.
Right. It pulls
and
it forward.
It bumps against whatever it bumps against in there, and it makes it sore. So I thought maybe it was just that I hadn't exercised it for so long, you know, and I really wasn't.
No, that's not it.
So much, you know?
I don't think that theory holds water, so to speak.
Okay, I just came up with it. You know?
Yeah, I don't think so. I think it has to be examined and maybe X-rayed or some other test.
Well, I have had it X-rayed a while ago because I had the same doctor look at it, and when we X-rayed it, there was no problem with the bursa or anything.
And the joint itself and the bones all checked out okay.
Yeah.
All right, good. So the X-ray is limited. It doesn't tell us all about the tendons and all about the ligaments, but it does tell us that the joint space is adequate. You don't have osteoarthritis there, which is a possibility otherwise. And
didn't find any of that.
And you don't have any occult fracture, unnoticed fracture or calcification or infections or tumor, all these things that are quite rare but possible. But
no, all that
otherwise,
was checked out about a year plus ago.
Yeah, the X-ray can miss quite a bit because it only shows us what we call the radio opaque, the things that stop X-rays. It don't like bone. It only shows us that. So,
I am 54 and I've been surfing since I've been 8 years old, so it could be a little wear and tear there.
I suppose, but that's not a diagnosis either. What you want to know is what the heck is this, and what you can do about it. And you can't know the second thing until you know the first. So the first thing is to figure it out, and just to go to your surgeon, he says just exercise it. That's not good enough, I'm afraid. You need to know a more precise diagnosis. So go back to him and say, let's look into this more. I'm concerned it's not going away, and I need a diagnosis, or you're welcome to come see me, of course, after the new year, because I'm gone until then. But
I'm working anyway, so.
Yeah. So, and then if you work, it's hard to get to the doctor, but we have a doctor working on Saturday over in Kaneohe, Dr. Fernandez. He could see you. Do you work Saturdays also? Yeah,
actually, I'm on my way to work right now.
Yeah. Well,
I'm a self-employed guy, so I work odd hours too.
Join the club. What kind of work you do?
I'm an electrician, electrical contractor.
And you work for yourself?
Correct.
And you pull wire and everything?
Yes. Drill holes, I do all that. I do it all myself, so it's like.
Well, you're going to need a diagnosis. That's my bottom line here. And to get one, you're going to need a careful physical exam and somebody who is interested and familiar with soft tissue injuries.
And this guy seems to be, and I think what I've got to do is press the issue, like you said. Just, I just kind of say, I'll go do the exercise.
Yeah, go back to him. Go back to him and twist his arm a little bit.
Right, but I got one more question, though.
Go ahead.
The exercises really do help a lot. Does that help with your,
I mean, I didn't, as long as they're helping, I encourage you to keep doing them. But so many conditions are helped to some degree by exercise that it doesn't help me diagnostically.
Got it. Okay.
Exercise makes any joint feel better, right? Because it moves better and it's stronger. But it doesn't help me get to the core diagnosis, to the actual problem.
Okay. I have to agree with you on that.
Yeah. So get the diagnosis. If you're not satisfied, get a second opinion. You may need fancy tests, I don't know, but first you need a careful exam.
Yeah, I think so. I'll do that. Thank you.
All right, and a Happy New Year to you, Brian. Get out there.
Happy New Year. Aloha.
Aloha. Let's see here. I dropped this call. 521-8383. The lines are open. Give me a call if you have any questions regarding arm, leg, neck, or back pain. I'll be happy to try my best to answer your orthopedic-related, sports medicine-related questions. Some people are injured in car accidents and have a sore neck. Some are injured at work and they have a sore back or a sore elbow or a numbness in the hand. Some people are injured around the house, too much gardening or too much knitting or other handcrafts. We see all kinds of patients at our office, both in town on Bishop Street and also in Kaneohe over on Kamehameha Highway. And we also, by the way, talk on this show about other more general health-related questions. And more, I'm going back to my roots. I started out as an internist, a general internal medicine guy, before I subspecialized into this physical medicine, rehabilitation, non-surgical orthopedic business for the last 3 decades. But now I'm turning back to my roots and I'm getting involved in general health, weight loss, fitness, lifestyle change. And we have a great program starting early in the year. It's called, I'm embarrassed to say, but it's called the Portner Protocol. But what it is a comprehensive approach to not just weight loss, which is the foundation of it. We help people lose weight. but also lifestyle change. And we help people incorporate routine, safe exercises, eating habits, and activities to actually make a positive change in their life. So this is the time of year that we start to reflect on the life behind us and look forward to the life ahead and make some resolutions. And what could be better than the resolution that I'm going to do something for myself? I'm going to stop living in a way that's negative and is signing me up voluntarily for diseases and conditions and hospital stays and doctor's visits and medication that I can avoid if I start to use my brain and I start to take better care of myself. So we'll talk about that too, but I have Joe on the line. Let's see. Joe, go ahead. You're on the air, and thanks for calling.
Yes, Dr. Portner. I'm 77 years old.
Yes.
And I have had minor back problems most of my life.
Yes, like everybody else.
With about the last 6 months, it got progressively worse. I used to walk about 3 miles a day, and it's gotten to the point where I can't even walk I can't walk 100 yards without sitting down and resting.
And where is the pain mostly that makes you sit down?
Well, I went to the doctor. It's in my legs and hips.
It's in your legs and hips.
I have an MRI. The reason I'm calling is there's been some kind of a mess up with my provider, my doctor, and me, and they have me scheduled to explain this to me on January 30th, and they have tentatively scheduled me to have a shot in the back on February 3rd. Well, that's more than a month away, yeah?
Yeah.
And I still don't know what this MRI report means, and so I was just wondering if maybe you could explain a little bit.
Do you have it with you?
What my options might be. I have
Do you have the report? Do you have a copy?
I have it right in front of me, yes.
On the bottom where it says impression, does it say spinal stenosis?
It says degenerative disc disease at L4, L5 with marked interspace narrowing, mile 4 on 5 retrolithiasis.
Yes.
Accentuates a broad-based 4-5 bulge.
And that's it.
Bulge combines with facet and ligamental hypertrophy to result in canal narrowing, which is mild to moderate in degree.
Right, so canal narrowing is another way of saying spinal stenosis.
Uh-huh.
So, you have a canal that goes all the way from the hole in the bottom of your skull to let out the spinal cord, and goes all the way down to your tailbone. This canal, spinal canal. Yep. And that canal holds your spinal cord and all those nerves. And when that canal becomes narrowed, it results in pain, in this case, pain in the legs with standing or walking, relieved with sitting down. And that listhesis they're talking about, that's a forward slippage of one bone on the next. And that adds to the spinal stenosis, and they describe a lot of other things that add to the narrowing. Stenosis means narrowing. That's the same. It's the same condition. So you have a spinal stenosis. Your MRI confirms it. Your history is very much in line with that diagnosis. So chances are that's what's going on. To have a shot is not a bad idea. I do that all the time. There are other treatments that we often try first because sometimes treatments like traction can be helpful and certain exercises can be helpful, and that should be done in any case. And I agree with you 100%. Waiting another month plus is not reasonable. That your life is kind of in a standstill, so to speak, because if you can only walk 100 yards, you can't really do much. You can get to the bathroom, you can get to your car, you can park your car, especially if you have a handicap pass, you can maybe park your car in front of Safeway and go grocery shopping, but I bet you got to lean forward on the shopping cart when you walk up and down the aisles, don't you?
Oh, yes.
did I call it? So
Yes.
that's a typical sign of spinal stenosis. Do you use the computer?
Yes, I do.
Well, go ahead and look up spinal stenosis. You can go to just Google it, or you can go to a website called WebMD, and or you can go to a fancier place called Google Scholar, and then type in spinal stenosis. You can learn all about it. And having that shot they're talking about is not a bad idea. But waiting a month and a week is not a good idea, and not trying anything else in the meantime also kind of is not smart, because sometimes, for example, traction, and I mentioned exercise, can be of benefit. So don't cancel the shot. Don't cancel the follow-up visit. You might call the doctor, although this is going to be a hard week to get your doctor, but
yes,
you might call your doctor after the first and say, I understand that I have spinal stenosis, narrowing of my spinal canal, and I understand this shot, probably an epidural. I don't know if they mentioned that word.
That's what they said.
Yeah, so epidural injection, I know that's probably going to help, but gosh, it's a pity to wait so long. Can't I have that?
That's why I decided to call you.
Yeah.
You did mention traction. What do you think about the inversion table? So you put
let me talk about that. That is a form of traction, so you're correct there, but it's not optimal. First of all, you have to be upside down, so at 77, being upside down is not that pleasant, and you can actually damage your eye, and you can get sinus stuffiness, and it's very difficult to tolerate for more than a couple minutes at a time. Traction is most effective when you can lie comfortably horizontally, not upside down vertically, and for a half hour and get good traction. So I'm afraid it's not the best option, but if that's all you got and you have access to it, and maybe you can tolerate it and not go perfectly vertically 90 degrees perpendicular upside down, but at an angle, it might be worth a try, but that's not my first choice. You can easily go to a physical therapist and get a proper traction in a horizontal position for a half hour, get that every day or every other day, and that could be quite helpful.
Okay.
But let me leave you with this, Joe. It's a very common condition, especially in people over 5 or 6 decades old, and that's us. And it's quite manageable. And usually these shots are effective, at least temporarily. And the exercises and sometimes traction or other therapies can also be helpful. And your walking tolerance, which is what you should monitor in order to determine if any treatment is successful, monitor the distance or the time that you can walk before you have to rest. And if all else fails, there's very good surgery for this. And I'm saying this, and I probably know I'm not a surgeon and I'm not quick to recommend surgery, but this is a condition where if all else fails, it's safer to have the surgery than not.
Okay.
So you don't want to, you're 77, you sound like you're in good health, you got some more years ahead of you, let's do it walking, and try this, try that, try what they say, and if nothing else helps, and they offer you surgery, seriously consider those options, and get a few opinions, and get fixed, if you have to.
And I'm not going to see them until January 30th. I'm wondering if there's something I should be doing between now and then, or do you think I can get in to see another doctor?
Well, you could certainly see me or one of my associates first week of the year, probably.
Okay, I'll do that.
Certainly get that and bring that report with you.
Yes.
And we can try a few things and even get you that shot quicker if it comes to it.
Okay.
All right,
that
Joe?
Sounds like a plan.
All right. Happy New Year to you otherwise.
Thank you, Joe.
Thanks,
Joe. Thank you very much, Doc.
You're Joe. I'm the doc. Okay. Take care.
Bye.
Bye-bye. All right. Let's see. 521-8383. give me a call if you have any questions regarding arm, leg, neck, or back pain. I'll be happy to take your call. Before that last caller who bailed me out here, I was talking about how I am getting interested in a more holistic approach to my patients. Now, holistic, that's with a W. And I do that now because I'm a rehab doctor, so we always are holistic in our approach, meaning we look at the big picture. We don't just look at the x-ray or the blood test. We look at the activity level of our patients and their ability to function, and we try to improve that functionality. And by that I mean very mundane things. Get up out of bed, get dressed, go to the bathroom, shower, get on the bus, go to work, do your job. You know, very simple activities that most of us who have normal physical capabilities never even think about until we lose them. Reminds me of a song from the 60s. Anyway, but we don't know what we got till it's gone. We discuss and we address function as a physiatrist. Well, holistically, I've been treating people, for example, with osteoarthritis of the knee and osteoarthritis of the hip and degenerative arthritis of the back for years and years and years, and fairly effectively at times. There's no cure for these things, but we can treat the episodes and get rid of the inflammation and teach people to do certain exercises and sometimes modify their homes or provide them with a brace or a cane, anything that it takes to get them to be able to get from A to B, to function, to walk, and so on. And but some of these people weigh 300 pounds or 250 pounds or 220 pounds, and they should weigh 50 pounds less or 100 pounds less. And it's almost hopeless. Hopeless in the sense that the recurrence rate is very high. Not in the sense, it's not hopeless in terms of that particular episode. You come to me and your knee is all swollen and red and warm, and the x-ray shows bone on bone. I mean, I can address that and make you feel better. And maybe even buy you some time and give you a few months of better walking. But it's not something I can cure. But not yet, anyway. We can talk more about stem cells and how they're coming into the picture. But what I can do, and what I would always tell my patients is, look, you know, let's get this better, and then I'd get them better, and they'd come back after their therapy or after their shot or whatever. And I'd say, okay, you're good. I'm glad you're feeling better, but, you know, you got to lose 50 pounds. You're not going to be able to do this. You're not going to get away with this. This knee of yours or this hip or whatever joint it is cannot tolerate all this extra weight. Not to mention your heart and your blood vessels and your blood pressure and all that and your diabetes. But you got to lose weight. But I had no way of helping them. I would say, you know, try one of the commercial products or go to Weight Watchers, which, by the way, does work. And but I would just say, you know, just eat less, for goodness sakes. And, of course, that doesn't work. I mean, eating less does work. But telling people to eat less doesn't work in terms of getting them to eat less. What I'm getting to is this. I've finally taken the plunge, and I've gotten interested again, because in the 70s I was very involved in weight loss programs. But I've gotten involved in helping people lose weight. So, and it's not just a weight loss program, because that's not all that it takes. It's a lifestyle change. And what does that mean? You hear it all the time. What is lifestyle change? Well, let's say it's your habit to come home from work, have dinner, and then sit down and watch TV. That's a lifestyle that's got to change. We sit too much. Most of us don't have heavy-duty labor jobs, digging, carrying rocks. Some people do, and I'm not talking about them. I'm talking about desk jockeys or sedentary people or people who tend to spend a lot of time in front of computer screens of one or type or another. And this is and are overweight. This is a situation that is intolerable and literally unsustainable. It's going to cost you. So this new weight loss program that I'm initiating in my office, we will address activity, habits, teach people how to assess the types of foods that they buy, the types of snacks that they buy, the types of groceries that they buy, the types of meals that they prepare, their general activity levels throughout the day. And we're also using this to start with, a very low-calorie, high-protein diet product where people's weight will melt away, guaranteed. And I guarantee very little in this world, especially this world of medicine. There's not much to be guaranteed, but I can guarantee that if any of you sign up for this weight loss program and stick to it, your weight will melt away, and we'll do our best to help you keep it off. It turns out the challenge is not the initial weight loss. The challenge is the maintenance of your proper weight for the rest of your life, and that's what I'm in for. So this is available through my office. It's called the Portner Protocol. I'm a little bit embarrassed to say, but that's what we decided to call it. And it's unique, and that's why it has my name attached, because it's not just the powder, it's not just an exercise, it's not just this, it's the whole shebang. It's the big picture, and it works. So here we're talking about New Year's resolutions. This would be a good one. We're talking about giving gifts this time of year. Gift to yourself or to your loved one of, let's say, a gift that says, let's live more healthy the rest of our lives. How's that for a gift that keeps on giving? One time, a friend of mine was celebrating his 50th birthday, and and it was no presents to the party. Well, forget that, we said. And a half a dozen or a dozen of his friends got together. We all pitched in, and we bought him a surfboard. And this guy's been using the surfboard at least once or twice a week for the last 10 years. That's a gift that keeps on giving. Well, so is this weight loss program, lifestyle change program, Portner Protocol. You can call the office if you're interested. Of course, probably not right now unless you just want to leave a message. But if you're interested in learning more about it, it's recommended and it works. Let's see. I just give you that office number in case you're interested. 596-7300. 596-7300. Tell them you're interested in Dr. Portner's weight loss program, and they'll get you some information. It won't be starting for another few weeks, but we're going to get it going really soon here. Doris in Kaneohe, go ahead. You're on the air, and thanks for calling.
Hi, Dr. Portner.
Yes, hi. Good morning.
Hi. I have a lot of major injuries on my work throughout my 23 years at work, like back, neck, and torn rotator cuff.
Yes.
But my last injury was in 2013, where I wasn't getting better after exhausting all the physical therapy. So the orthopedic had put me to MRI and also said that I had lost the cartilage in my injured shoulder, my right shoulder, and I had severe osteoarthritis.
Of your shoulder?
Of my right shoulder. But in 2008, I had a total shoulder rotator cuff repair. And then I went back to work, and then in 2013, I got injured again in doing patient care. And this time, the pain just wouldn't go away after I did a lot of physical therapy. So they did an MRI and found out that arthritis had really set in, and I was in a severe state of osteoarthritis, and I had no cartilage, so it was bone rubbing against bone, and that I could benefit from a shoulder replacement. So they consulted to quite a bit of orthopedic. They referred me to many at Queens, and then they finally sent me to Stanford, But in the MRI, they found a lesion, a cutlet lesion, so they wanted to get it done right away, and they needed a dual surgeon, they said, to get rid of the lesion and do the shoulder replacement. But what I noticed was in 2008, that cartilage was still present, and it wasn't even mentioned to me. But anyway, it was benign, and they said they didn't have to take it out, but since they needed the space to put the rod in my bone, they took it out, they scraped it out anyway, so it's not there any longer.
How's your shoulder doing?
Well, when I came back to Hawaii, I followed everything they said. I had already prepared. I started doing exercises what I could, because I have neck and back injury, so I limited. But I did what I could. I had changed my diet, so I could get quick recovery. So when I went there, I was in, the best shape that I could, So when I came back and I followed everything to the T, my PT was held up for 2 months and a half, and I got locked in my right arm. And then when they finally approved the PT, I managed to get the arm moving again.
I see.
But
and you never got
a lot of limitations, and my neck started cracking and popping.
Hold on, Doris.
Right.
Hold on. Let me interrupt you. Let me understand. So you never got your shoulder replaced?
I did.
You got your shoulder joint, had a total shoulder joint replacement?
Total shoulder, right.
And that was at Stanford just last year?
Just last year. So I'm in my going on my 7th month of recovery, and only had 16 physical therapies.
I see.
And most of my therapy I'm doing at home with the bands and stuff.
Yeah, but you're not satisfied with the workings of your shoulder yet. It still hurts you and doesn't work very well?
Yeah, and they said the surgeon at Stanford, when I called her, she said, you shouldn't have any pain because there's no shoulder in there. What you're having when you get the sharp pain is the muscles and the nerves trying to reconnect, but since they're not giving you the therapy in the timely manner that I recommended, is why you're getting locked up in the sharp pain.
That may be true. Why the delay in your physical therapy? What's the problem there?
Well, it was a worker comp injury, and the worker comp said that this is not, they denied, as soon as I came back from Stanford, they cut me off because they said it was not their responsibility because of the lesion.
Right. They say
even though it was benign,
Well, that's not the issue. And so you're going to physical therapy on your private insurance?
Yes, I am. And that's slow to come too.
What is your private insurance?
HMSA, PPO.
And usually they allow you to have 8, and then you have to get special permission.
Exactly. So you wait in between. There's a long wait in between, like 3 weeks to a month.
Have you gone to HMSA and tried to explain this to them?
Oh, you don't know. Yeah, many times, and I even called the doctor and everything, and the doctor put a case manager on my case.
Right. Well, the best you can do, Doris, I don't think I'm going to be able to help you. The best you can do is to do those exercises every day as best as you can. And also see your doctor. You started to mention your neck. It could be that some of your shoulder pain might be coming from your neck, so have your doctor look at the neck. Talk to your physical therapist, because it turns out that in order for HMSA to approve additional therapies, your physical therapist is key to writing a report to what's called Landmark. Landmark is this crazy mainland company that has to approve all the extra physical therapy for HMSA. And if the physical therapist is on top of it and explains the situation that you're post-operatively recovering from a total joint replacement and you need the therapy quickly, they will usually comply. So you can talk to the doctor and you can talk to HMSA, but I would talk to your physical therapist and say, get those reports in and so on. And then the other thing you might do is talk to an attorney, because sometimes an attorney will write a letter and say, you know, you guys are being negligent. My client here, poor thing, had a shoulder replacement, and her surgeon says that she's doing poorly because the physical therapy is not happening. And that might light the fire under their feet and get them moving. So
I appealed once and I got it denied, so I'm appealing again.
Are you talking about appealing your work comp case?
Yes.
Well,
yes.
I'm talking about appealing to Landmark. Because you're going to appeal to work comp. You can appeal all you want. It's going to take years. And you might win, but you might not. In the meantime, I would suggest that you talk directly to Landmark and maybe have an attorney write you a letter.
Okay, I do have an attorney, and I will have them do that, and I'll also tell the PT that they need to start submitting the report.
Yeah.
Do they submit it to the surgeon or to Landmark?
To Landmark.
All right.
All right, Doris. Happy New Year, and I hope you do well.
One more question. The main thing while I called you is, like, what do you recommend on the market, or can the physician write a prescription that I need some kind of bone regimen because I'm so fragile?
Well, that's a different issue. If you're fragile, you mean you have osteoporosis?
Like my bones, my hips get stiff, my joints cannot move. I'm 58, but I feel like 88.
There is no magic for that. You have to talk to your doctor specifically about each and every complaint, and it has to be sorted out. To say you're fragile doesn't accurately depict what's going on. You have to be addressed each and every step of the way.
So it's not about going to the drugstore and buying calcium, magnesium?
No, absolutely not about that.
Oh, okay.
All righty?
All right. Okay, thank you, Dr. Portner.
You're welcome.
Bye-bye.
Happy New Year, Doris.
Happy New Year. Bye-bye.
Bye-bye. 521-8383. People get mighty confused, don't they? And half of my life, half of my professional life is trying to... let's see, what happened? I don't know what's going on a minute here. I'm trying to... there we go. My fault. Half of my life is trying to help people better understand what's going on and disabusing them, unteaching them things that they believe to be true for one reason or another. And I have to convince them that that's not the way the world is. You know, you can't just go to a store and buy some calcium and expect that all your aches and pains will go away. You can't describe your condition like, you know, I'm fragile and I ache all over and I got to make my bones stronger. That's a lot of skipping steps to take before you conclude, you know, I got to start taking calcium. It turns out that very few people, even those with osteoporosis, need to take calcium. It's overrated. Most of us in Western culture, unless you're on some crazy diet that eliminates green vegetables, fish, milk products, and meat, you're likely getting plenty of calcium and vitamin D, and it doesn't help that much to take more. In fact, some people end up having complications because they're taking too much calcium or too much vitamins. So the answer is rarely in some store. The answer is in science. You have to have a diagnosis and then a proper treatment. Let's see. I have another caller. Betty. Betty, go ahead. You're on the air, and thanks for calling.
I just want to thank you for being on the air because you've been such a great help to so many people. I had MRI yesterday, and they don't really explain anything. Like you said once on your program, I understood it was going to help the pain in my feet, legs, and back. It said on the MRI, blah, 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 but that I could have that, which was misdiagnosed earlier on, like 7 or 8 months ago. But so what I'm asking is, they do it, but then you can't get any questions asked because everybody's gone at this large place that I go to. There's no one around.
Well,
and
you just
I woke
had
up with such a very bad headache today.
Betty, hold on a second. You just had the MRI yesterday.
Yes. Is it normal to be just in terrible pain the next day with a headache? And
No. The MRI has nothing to do with
No.
It
wasn't MRI. I had the I think I just said the word, or maybe not, because I'm nervous. The epidural.
Oh, I see. You had an epidural yesterday.
Yeah.
And today you're suffering with headache and what?
I have my toes, feet, legs, thighs. But when I got through, I said, I'm just so grateful because I won't have this pain in my back. And the whole time I was on that table, I mean, my back was just killing me. He said, no, this isn't for your back. This is just for your legs.
Well, it'll sometimes help the back as well.
Oh, okay.
Just
I should just be more patient?
Betty, slow down a second. Slow down. Take a deep breath. Yeah, blow it out. Take another one. Just relax a minute, okay? Because it's not going to do any good to be frantic.
All right.
Okay, so slow down. Now, you had a shot yesterday, and it was given for probably all the right reasons and in all the right ways. And these symptoms you're having today, aside from the headache, the feet symptoms and the leg and the thighs, are those the symptoms that you've been having all along, or are those brand new symptoms?
No, they're the ones I've had for 7 months.
So don't judge the shot 24 hours later.
Okay.
You need to relax and think positive, happy thoughts. And hopefully in a week or 10 days, the shot will kick in and we'll see how it helps you. And sometimes it helps, and frankly, sometimes it doesn't. And sometimes it helps partially, but significantly, and the shot can be repeated. So don't fret. Now the headache, that sometimes happens after an epidural injection, or sometimes people just have headaches coincidentally, unrelated to the shot. I don't know.
Okay.
As long as you don't have any other symptoms like fever or stiff neck or anything else that's different, just watch that headache. You know, it'll probably pass. And it's likely that this shot will help you. So still, you have to give it some time.
Okay.
All right, Betty, you feel better?
Thank you so much.
Good. You're welcome. And have a happy New Year.
You too. Bye-bye.
Bye-bye. Okay, yeah, sometimes you just got to slow down here. Bonnie, go ahead. You're on the air, and thanks for calling.
Good morning, Dr. Portner. Happy New Year.
Happy New Year.
Now, I've got a question. About 3 weeks ago, just out of the blue, I had just walked in the door, came in the house from a short walk, took my shoes off, stood up, and I felt like somebody had taken a sledgehammer and hit me on the back of the foot. I went to the doctor, and he diagnosed me with a severe ligament tear by my ankle.
When you say back of the foot, help me out here.
By my ankle.
By the heel?
Heel, yeah, the heel. It was the pain was excruciating in my heel.
What were you doing at the time?
That was the crazy thing. But I said to the doctor, I wasn't doing anything strenuous. I had just come in from a short walk, and he said it was a buildup from over the years because I used to be very, very athletic for 30 years.
And when you say ligament, are you sure you mean ligament or do you mean tendon?
He said it was a torn ligament.
In the very back of your ankle?
No, now where I have the swelling and the pain is by my ankle.
On the side?
On the side, uh-huh.
I thought you said the back.
Well, that's initially where my pain started. But when I got into the doctor and he examined me, he said it was a torn ligament by my ankle.
I see. And this was how long ago?
3 weeks ago.
And how are you doing now?
Well, that's actually why I called. I wanted to get your opinion. He told me I should wear this. It's called the boot. It looks like a ski boot. I know you're familiar with that.
Yes.
Big and clunky. Well, actually, the past week, my foot, it hurts worse when I wear the boot.
Right.
And I was really confused about that. Now, I see him again on Tuesday, And I was thinking, well, maybe the pressure points on the boot need readjusted. Maybe that's...
And you've been wearing this boot for 3 weeks?
No, I really haven't. I wear it part of the day.
And how do you feel when you walk without it?
It hurts worse when I've got the boot on.
And do you feel like you're improved? You're getting better?
It has improved a little bit, but as I said, every time I put the boot on, it hurts worse.
Well,
so I don't know. What do you think about the boot? Do you think it's a good thing?
I think it's overused, and I think it's not only overprescribed, but it's used too long, and it's used in lieu of treatment. So, what treatment would you recommend for a torn ligament? I would recommend a treatment called friction massage. I talk about it on the show all the time.
Oh, okay. Yeah, I've heard you talk about friction.
It's a very, I don't know that you have a torn ligament. That's what some guy says. But just putting a boot over it as if, out of sight, out of mind, and resting it, you're going to end up with a very stiff ankle. And and generally speaking, I don't like when any treatment hurts. So, with some exception. But if you put on a brace and it makes your pain worse, you got the wrong brace. I mean, that's not right. It either, we're not even talking about whether a brace is a good treatment or not. We're just saying if it makes it worse, don't do it. When you walk without the brace, without the boot, do you limp badly?
When I first get up in the morning, yeah. Really bad. Real bad.
Is the ankle still swollen?
Yes.
And was an X-ray taken?
Well, he did an MRI.
I see. And the MRI is what prompted him to say you had a torn ligament?
Yes.
That's probably accurate, although MRIs notoriously show things that are not always relevant. But 3 weeks is a long time. Wearing a boot for 3 weeks is a long time. And
Billy told me I should wear the boot 24 hours a day and even sleep in it.
Yeah. But what about, maybe that's true, I don't know, because I didn't see the MRI. But no other treatment was offered? No physical therapy, no friction, no shots, no medicine?
The only thing he said was after it starts getting better, after wearing the boot for 2 months, then he would refer me to physical therapy. But he wants me to wear this boot for 2 months.
I see. Do you have another option? Can you get another opinion?
Yeah, I can.
Do that. Listen,
I wish I could come and see you.
Well, you may. You certainly may. You just have to get on a plane. Bonnie, I'm going to have to cut this off because we got 40 seconds here. 30 seconds.
Okay. All right.
All right. Happy New Year, and thank
you
for the call.
so much, Dr. Portner. Happy New Year.
Bye-bye. You're welcome, everybody, and thanks for the compliments. So I just have 10 seconds to wish you and yours a very healthy and happy 2015. Can you believe it? Take care, everybody, and see you next week. Thank you for listening to The Moving Body. Hope you enjoyed the show. Remember, if you're having problems with your arms, leg, neck, or back, and would like to get an appointment over at the office on Pecoy Street, you can give us a call, 596-7300. We're open 6 days a week and have a full line of doctors, therapists, EMG, and a great office staff to assist you. We try to respect your time like we hope you respect ours, so people are seen on time. You don't have to expect to spend the whole morning if you have a 9 o'clock appointment. We'll try to see you right then and there. Remember the warning signals that I talk about throughout the show off and on. If someone tells you that it's only your age to live with it, that the x-ray is normal, nothing's wrong, that it's, quote, arthritis or bursitis or tendonitis, but they haven't really examined you very carefully, be cautious about that. Ask for another opinion. If you're told to have surgery, ask for another opinion. If you're told nothing else can be done about it, you want to say, well, maybe you can refer me to another specialist. Maybe they have a better idea. Don't just accept those kind of things. Don't forget to tune in next week, same time on KHVH. Go out there and exercise this weekend. It's the single most important thing you can do for your health and body. Health cannot be bought off the shelf. Special nutritional supplements is not what it's going to take to improve your health. It's going to take a lifestyle change. It's going to take for you to put on some good walking shoes and get out there and take a walk every day. We'll see you, everybody. Have a good, healthy weekend, and tune in next week. Bye-bye.